Good afternoon, everybody. Thank you for joining us today. Our topic today is the coronavirus outbreak prevention, and this is our series 1 of 4. Last week we did our first initial launch, and due to popular demand, we decided to continue this, and we're going to have a series, 4 more series on the following Fridays from here on in, and this is series 1 of 4. As always, make sure that you submit your questions during the presentation, and we'll answer those at the end. So put them in online as you did last week. For those that are joining us this week, make sure you put them on there. And today we're going to actually extend that period a little bit to hopefully answer those questions as we go along. For those of you that don't know me, my name is Jim Fleeler. I'm Vice President of Sales for Canada for Charlotte Products. Also responsible for training and innovation. Joining me today is Asquith Williams, and he's our head chemist and in charge of infection prevention and the chief executive officer the chief operating officer for Charlotte. And he's going to help me at the end with some questions and things due to overwhelming demand. The thing that I do different, and the whole team here, is we listen very well. We listen to our customers. We make sure we're engaged with them. We listen to their challenges, and most importantly, we have a long-term track record of really providing solutions, fine-tuning them for their particular facilities, and helping them achieve healthy, safe spaces. There is a major focus on cleaning protocol improvements globally, from a low level right up to the highest level in every type of facility. And really, that's a good thing to see. I mean, everything is bad news, negative news, and believe me, that's the utmost important. But when this passes, we honestly believe we'll be in a stronger position. You're seeing the cleaning protocol from any type of facility, public transit and streetcars and subway and planes and buildings and restaurants and grocery stores. You're seeing an elevated need of cleaning properly. And quite honestly, for too long, we've just sort of failed a little bit there. So this is good for us all the way around the world, as a matter of fact. Last week, we talked about cleaning protocols to lower the risk of an outbreak. It was very well received. There was a multitude of questions, hundreds and hundreds of questions, and also requests for the copy of the presentation. That presentation is on our Charlotte website, without question. You can go to charlotteproducts.com, and if you go to the tab Media Center under videos, you'll see it there, and you can see that, and we'll have that on there for the foreseeable future without question. There's been an ongoing communication since from all of the attendees asking for honest guidance. How can you help us achieve our goals? How can we stop the spread? How can we lower the risk? All of those types of things. And we've been quite honestly inundated 7 days a week, 20 hours a day with trying to respond to everybody. And believe me, we're dedicated to achieving that. We've responded to your request for ongoing sessions. So like I say, this is series 1 of 4, and we're going to continue that each Friday at 1 o'clock for the next 3 weeks there. And that really leads to today's session, okay, is what it does. So today this is the series 1 of 4, and we're calling it Cleaning Protocols to Lower the Risk of an Outbreak. We're going to introduce our latest Enviro Solutions ES15 ready-to-use outbreak prevention program for preventing coronavirus or COVID-19. And we've actually got a YouTube video attached here, which is just under 3 minutes long. That'll help explain that to you there, okay? We're going to talk about the supply chain and our Charlotte product manufacturing update, what we've done to assist you. And believe me, we've upped our game without question and invested in raw materials and skilled labor and everything that we can do to really turn this around. And towards the end, we're going to have an open mic question and answer period there. We've actually expanded our resources and links and things where you can actually get more information. So this week's opening remarks. There's a high level of anxiety. I mean, you can't look at a newspaper or listen to a radio station or a TV station or any form of media, and believe me, it's a serious situation. You know, what we recommend is that we all work together, we all learn together, we all listen, we all communicate, and we all be realistic. You know, when governments and the Center for Disease Control and the EPA and the World Health Organization, when they're telling us the seriousness of social distancing, we should respect that. You're seeing all kinds of positive moves across the whole entire planet here, which is again going to be a good thing for us. The coronavirus has developed into a public health emergency of international concern. Last week, there was rising concern. The week before, rising concern. This week, obviously, it's just here without question. There's continuous government updates from both provincial and federal levels. The Center for Disease Control, the World Health Organization, public health coming to the table on a regular basis. Also the CBC, which is the Center for Bioscience, they're there without question, fast tracking any threats and disinfectants and sanitizers that can help with the emerging issue that we're faced with. Borders are closing. If they're not closed now, they'll be closed shortly, except for export trade, and then there's stringent guidelines there. Businesses are closing. They're reducing hours. Travel is limited. I mean, there's no longer are you allowed, or it's certainly not recommended to travel outside of your own country. Social distancing, the impact that's had on Charlotte, we've done a tremendous job of actually working with that and making sure we take care of every single one of our hardworking employees, and they're working extremely hard. Self-quarantine, when you are self-quarantined, you really need to respect that, right? We're respecting it in our business lives and our house lives, and really the experts are telling us that seems to be one of the best moves we could possibly make to really come out of this quickly. Health agencies globally, they continue to increase all levels of communication. They're sharing ideologies. All of the medical experts are getting together. You're seeing medical staff that have retired coming back, nursing, all of those things, everybody doing their part, which is a terrific thing. Our manufacturing facilities, they're running near capacity. They're producing all of our existing line of disinfectants, sanitizers, floor finishes, general purpose cleaners. We're ramping up inventories. We've ramped up inventories. We are working 6 days a week, 20 hours a day, with an emergency crew ready for Sunday for dire situations. So we're absolutely going over and above the call and really trying to help you out here. We're now in production of our brand new Enviro Solutions ES15. That's our ready-to-use outbreak prevention program, that spray and wipe disinfectant, which we'll talk about today. We wanted to revisit this point from last week, really, because, and there's some updates here, but really this is our thought process. I mean, it's important that we don't panic, and believe me, it's very easy to do so. In this day and age, whether it's at work or at home, it's very easy to do. I mean, we had spring break, it couldn't have hit at the worst time, all kinds of disruptions, all of those things. I mean, believe me, it was just people in their house that used to go out and do sports and be active, and the flights and the vacations. I mean, that alone just is stressful, but add a pandemic in there and it's even worse. Be wise and vigilant. We can't say it any easier than that. You need to continue to ask for help from industry professionals. This is one of the main reasons why we continue to have these webinars here. And we're available offline. Call us offline, email us offline. If we don't answer the phone right away, or the text or an email, we'll get there, okay? You want to prepare. Also, you can email questions to info@Charlotte at any particular time, and there's resources at the end. You want to prepare for today and tomorrow. You want to have the proper inventory. You want to have extra inventory. Try to avoid the hoarding. That's something that's something that that really is frowned upon, and all of the people are telling us from logistics that we won't have a problem with that. So just heed caution there. Revisiting training procedures with your employees, your custodians, it's paramount, it's a priority. What we've noticed in the last week in our facility alone is we went through and revisited our specific training procedures, and we ramped them up. We improved them. We put more emphasis on PPE. We put more emphasis on even the cleanup of our tools when we were done in the shift. If you're using microfiber cloths and wet mops and you just put it in the custodial janitorial closet at the end of the day and let the solution fester and bacteria and viruses in the buckets, and the next day you go out and spread it around, you're creating a problem. So revisit those cleaning up at the end of the shifts. Take those mop buckets, take those cloths, dip them in a disinfectant solution, let them soak for the appropriate dwell time, give them a water rinse, wring them out and hang them to dry, and then you've got the reassurance of clean tools the very next day. Okay, increasing cleaning frequencies, those high volume contact areas and touch transfer points. Cannot say enough now. Even workers in facilities should be walking around with a cloth, whether it's a disinfectant, a sanitizer, microfiber cloth, whatever it is, cleaning their own areas as well. Everybody can help out. Don't just rely on the building service contractor or the cleaning crew. Now's the time to deep clean your facilities. Spring break, there's a lot of education sector accounts across the world that are taking that downtime now to ensure that they're cleaning those specific areas that could be at risk. So when we all go back to the workplace, the students all come back to the education sector, that we're in a clean, safe, healthy space. And preventative, the PPE, which is certainly personal protective equipment, can't stress enough all of those things. Keep in touch with our Center for Disease Control, with the World Health Organization for more accurate information for sure. Supply chain update, just thought we would talk to you a little about Charlotte here. We've doubled production. We're 20 hours a day, 6 days a week, all types of cleaners, floor finishes, disinfectants, sanitizers. We're meeting the need. We have started to partial ship a few orders where people came in and placed massive orders, and we just, out of respect to everybody across the nation, we're trying to restrict some of that, but we will get you the inventory that you need as it's prioritized without doubt, okay? We've increased our inventory of raw materials, of chemistry, of packaging, of all of our bottles and labels. We've even ramped up our production of deionized water. For those of you that don't know, that's the purest water known, where we put in every one of our disinfectant and sanitizing solutions. So we're starting off with a better quality disinfectant that'll give you the reassurance of those ppm counts, and in the end, a safer, cleaner result. We're discussing options now and really monitoring demand for even more production increase. We do have, obviously that depends on the orders that come in-house, and it depends on skilled labor, which it seems to be relatively a better situation to hire, but we do have more capacity here. So call us on us today and in the future to help there. We'll do everything we can do to help you. We're prioritizing all the orders received in-house. I cannot stress enough, you need to get your order in-house, then it's in the queue, then it's prioritized, and we can deal with it. If you're thinking you may need something, now's the time. Most of our disinfectants have a 1 to 3 year shelf life, as a matter of fact, too. And one word of caution, we've entertained and received more calls of people asking us for just current inventory levels, and we're having a hard time because we may have 10,000 of something at 9 o'clock, and at 9:02 we may have none. So please don't do that. We recommend you prioritize your orders and get them in-house, okay? The technical bulletin here, this is updated since last week. We have an array of these technical bulletins online at Charlotte. This is an immediate reference here for our on-the-shelf disinfectants that are registered with EPA numbers and registered with DIN numbers to be effective against this virus. And what you'll see is we have 16, actually we have 18 now, as a matter of fact. We had 16 last week. And at the bottom, you can see what our listings are for Canada. You can see what our listings are for the United States. And by the way, in this time, do not forget the emphasis on food processing, food service, those restaurants that are still continue to allow you takeout and maybe some drive-up windows, but not in dining. So just don't lose sight of that. At the bottom of Canada and the United States, you'll see that we have our ES15 there in both for total North America, and that's an example of just progress since last week. This Center for BIOCIDE Chemistries, this is really a pre-approved list of novel coronavirus COVID-19 fighting products. This update was March the 14th. I've heard rumor that we'll have another one in the next day or so. This is a listing of all of the approved products here. Now, these ones are categorization of EPA registered disinfectants that meet the emerging viral pathogens. And it's about 6 pages. When it started about a month ago, it was 2 pages or maybe even 1 page. And now it's actually up to 6, and it'll probably be soon 6 or 7 or 8 or whatever. But what this is they're fast tracking the testing approval and the protocol to help us with this emerging issue that we're facing here. This is also available on our website. Okay. The next thing I want to really emphasize now, our new spray and go outbreak prevention system or program. It's ES15. It has a Canadian DIN number. It's listed there. It has a USA EPA number. It's listed there. And really it's used as a ready to go spray and go disinfectant. It's really designed as a quick, easy way to apply it, specifically for areas with outbreak prevention and other common surfaces. And it allows you to respond immediately or avoiding cross-contamination. It's effective against a wide variety of microorganisms, including bacteria, antibiotic-resistant bacteria, viruses, coronavirus, norovirus, all of those things. It's ready to use. And why we did that is because there's too many dilution control devices out there that quite honestly are not accurate. In most cases, they could be running lean. If they're running rich, it's just as bad, actually, quite honestly, because you're leaving a residual for biomass to grow and things to grow and have a problem that way. If it's lean, it's not giving you the ppm count without question. Just think about your drinking water. If it doesn't have the level of parts per million of sodium hypochlorite, then you're going to get sick, right? So this takes away that mystery. That takes away this issue. You've got the reassurance of 100% accurate, the accurate ppm that you need, to get the job done. There's a 5-minute dwell time. Most disinfectants are 10 minutes, as a matter of fact, spray and wipes and things. We've got a 5-minute. We're norovirus. And in Canada, we've got a pleasant lemon citrus smell to it. In the US, we have a peppermint smell, as a matter of fact, and that's due to both DIN and EPA regulations. You can see the product. It's a ready-to-use gallon container, ready to fill that pump-up sprayer. So you take that pump-up sprayer, take the top off, fill it up there, and you pressurize it, and you're ready to go. We've also got the liter size 946 mil or the quart size with the trigger head. We had great discussions this week. We put the trigger head on it because that allows anybody in a commercial or residential application to take it out of the box and go right out into their facility and start to clean and disinfect properly. Okay, and in fact, now we'll take you to the YouTube video that we shot this morning, as a matter of fact. This is a live shot of me for those that don't know me, but Matt, would you just press? This is 3 minutes. Hi, I'm Jim Fleeler, Charlotte Products. I'd like to take a few minutes of your time today to introduce you to our brand new latest disinfectant technology, our Enviro Solutions ES15 Outbreak Prevention Disinfectant. It's a registered disinfectant with an EPA number for United States and a DIN number for use in Canada. For the first time ever, it's spray and go technology that we have, so you would spray and go and walk away. We've never ever had that before. It is a ready-to-use formula, so you're guaranteed the right ppm right out of the bottle every single time. There's no chance of it being inaccurate in ensuring you've got the proper kill claims. You have superior detergency. You have a broad spectrum kill claim for many types of viruses, many types of bacteria, including it's very effective against coronavirus. It's also registered to kill norovirus, and it has a 5-minute dwell time, which is very unique in the industry today. Generally, they're 10 minutes. Some of the unique features I said before, which we're really proud of, is you would basically spray and go, okay? The packaging, we have a 946 ml bottle or a quart bottle. We have a trigger head on top for ease of use in any commercial or residential application. We also have a 1 gallon or a 3.78 liter ready to use refillable bottle. And we also have our Enviro Solutions pump up sprayer. You just basically take the top off, fill to your desired level, put the top back on, pressurize, and you're ready to go. Okay, so as far as how, it's very simple instructions. You always pre-clean the surface first, without question. You want to remove gross filth, right? And then you just spray and wipe there, and then caringly, sparingly, and thoughtfully, you apply the disinfectant and you walk away. One exception, if you have a food contact service in processing or prep or something, you have to do a potable water rinse. Okay, so let me show you how it works. We're going to put our PPE on, okay, our gloves. We're going to just apply a fine mist on the surface. This can be applied on any surface, chairs, partitions, things like that. We're just basically going to give it a quick wipe to make sure we remove any gross debris or filth. And then we are going to spray, fine mist, and walk away. That's it. Except for if it's food contact, you need a potable water rinse, okay? So really the inventory now, let's talk about that because we are right in the pandemic season. We are producing it every single day. We'd suggest you get orders in the queue if you're looking for that for sure. And at Charlotte Products, this is really just another example of innovative solutions to assist you with creating healthy, safe spaces. Okay, so that was our YouTube video that we just shot this morning there, and hopefully you found that helpful. Some of the surfaces that you would use is if you're on boardroom tables and underneath and chairs of arms and tables and whiteboards and any kind of contact area. We went around our facility here and did all of the filing cabinets, and we were amazed at at how well it cleaned. It does have exceptional detergency without question. So we went around and did ledges and tabletops. We did countertops. We did the lunchroom desks and things like that, and it just worked tremendous. It did not leave a film behind. It did not, and actually the most important thing that I appreciated is when you went after and touched the surfaces, there was no smudging, there was no fingerprints. So that's an example of a clean surface. We've one thing here on hand soap. People have asked us about hand soap. We have lots of hand soap. This one here is our Enviro Solutions ES15. It's a premium lotion soap. It has exceptional detergency. It deep cleans hands, face, or the entire body. You can use it as a shower wash. It has really good lather. It's Ecologo certified, has a fresh fragrance, and you get 4,300 applications out of it a gallon. There's an actual mistake here where I say there's approximately 100 cases available. I believe it's actually about 1,000 cases, but for those people that are looking for a real good quality, simple, effective hand soap program, we've got that. So it is limited. So again, you need to act on it. Okay. The next slide here, we've got additional resources. We've added here to them this week. There's no shortage of links, educational links and things online. Emails are inundated started with them today and things, but we've added a couple on here as well. And then obviously our Charlotte products, email and experts and things. So in a summary, before we get to our questions, and please ensure you're adding them and submitting them as we go along. You know, we wanted to make this one a little bit shorter this week because we understand the importance of getting out and cleaning and that following that protocol. But we hope you found it helpful. This particular, you know, during this pandemic for sure. Now next Friday at 1 o'clock EST time, it'll be about the same time frame. It'll be an update and some new news and things like that. So we recommend you joining. We encourage you and others, all of us, to join. For those that are customers of Charlotte products, we invite you to invite your end users, because there's good information in there for them as well. We continue to learn every single passing day, every single hour, every single minute, and we're going to get better. When we come out of this on the tail end, we'll be a cleaner global world as a whole, just because we're going to have more focus on regular cleaning, the things that we take for granted each and every day. And really, that's what we're all about there. We're available to assist you at any time with your facility objectives upon request. We will certainly recommend you do that. And now joining me for questions and answers is Asquith Williams. And so we'll proceed to that now. And I believe they're online. I don't believe they're live, but I believe they're online. So, Asquith?
Well, good afternoon to all. Hello, Jimmy. Thanks for having us here. Thanks for you being online with us. We hope to educate you as best as we possibly can. And we also would like to, you know, that we're going to have a whole series of questions. I know that. And if that's the case, we can't get to you right now online. We will certainly be available via email at info@charlotteproducts.com. So, you know, we asked, if I can see a question coming in here from Aaron, why isn't ES15 listed in product catalog in the US? Well, we're brand new, and it will be there shortly.
Yeah, ES15, Asquith, as you know, is about 10 days in design. The manufacturing facilities turned around tremendously. In fact, there's a 6,000 liter and a 10,000 liter keg out there right now with it being done. So this is really less than a week old. It will be there right away.
Okay. Here's another question for us here, Jimmy. This is coming in from Sandra. You know, why do we need to wash our hands often?
It's the best line of defense. We recommend a regular, good quality soap, whether it's a lotion soap or a foaming soap. Not necessarily, you know, there's a little bit of question on should I have antibacterial or antimicrobial, and quite honestly, some of those contain products such as triclosan, which may be known or suspect carcinogen. So we recommend good quality soap. And that extra time at the sink to you know, produce a good lather around your fingers, your you know, cuticles and fingernails and things. And believe me, every time you wash your hands, and if you do it proper, you automatically feel better without question. So it is probably personally your best line of defense in a safer environment for you in the workplace and for your family and home life.
Absolutely. You know, we got some more questions there, Jim. You know, is ES15 perfect for me to use at my home?
Great question. Absolutely. Why we one of the reasons why we packaged it in a quart or a 946 ml bottle with a trigger sprayer is that so those people we call Mr. and Mrs. Mum that they can actually buy a bottle, a case, whatever. There's 6 in a case, and you can go around the house and you can clean all of those areas around laundry, areas around the kitchen, areas around the island, around the workshop, around the bathroom. bathrooms, the showers, the grout. I mean, it just goes on and on and on. And as a matter of fact, some people were told, and this is just as recent as a week, have been using it even when there's a problem with the cat or the dog, where they have a little mistake and they're using it there, blotting it up and then giving it a simple water rinse. So another example, Asquith, really of listening to the customer as to what they're looking for, and us actually producing it.
Yes, okay. I've got another question here from Greg, and he's saying he's seen pictures where the airlines and others are fogging spaces to disinfect. Is it necessary?
Well, I think we'll resort back to the importance of proper cleaning on an everyday efficient basis that meets the needs of your facilities. Your cleaning protocol really is based on the amount of people that come in your facilities, the type of soil loads that come in your facilities. Just running on an airplane, I seen a YouTube this week where somebody was using an industrial commercial type sprayer sitting in a passenger seat, fogging everything on the plane, including the fellow passengers around it. And quite honestly, that's wrong. Proper cleaning, you pre-clean the surface and then caringly, thoughtfully, and sparingly apply the right disinfectant and get the job done. That's your best line of defense, right? And I'll just add in here as well, the overuse of alcohol-based hand sanitizers is not the if you listen to the CDC and the World Health Organization, you always pre-clean your hands first, and then if soap and water isn't available, then obviously use that. Okay.
Absolutely. Here's another question coming in from Dennis. The product looks like it's a broad spectrum disinfectant. Any other products to higher level?
I'm assuming the question there, he's asking, do we have any higher?
I would imagine that's what he meant, but
yeah, we have a whole we have a list. We have 18 approved effective against coronavirus disinfectants on the shelf now. Low level, medium level. We have all kinds of different dilutions, all kinds of different detergency or soil load levels. If you remember last week, we talked about just don't go buy the biggest, baddest disinfectant with all of these kill claims, because if it doesn't relate to your facility, you're actually got a reverse an absolute reverse situation, and you're doing more harm. Select the right disinfectant with the right detergency, with the kill claims that you need to address specifically for your facility. And this is why it's important to consult with industry experts, because they can advise you. It's like going to the doctor. They advise you as to what you need for your situation. Well, call us the doctors without question.
Has the pricing been listed anywhere?
Pricing for ES15, I assume you're talking about?
Yes,
that's just coming out today. As a matter of fact, that'll be online. You can see
I guess we'll just see the Charlotte rep.
Yeah, I just look for the Charlotte rep or any of our distributors across North America. You can go online, request, but the pricing will be out today. Packaging, I'll just address that. It's 4 gallons per case, or 4 by 3.78 liter, and it's 6 by 946 mil in a case, or 6 quarts in a case. So that's your packaging.
And of course, another question here saying, what will the retail costs for the ES15 would be? What would that be?
Well, we haven't. That'll be established this afternoon. The retail cost.
Okay.
Yeah.
Okay.
The good thing about it is we made our first production batch Thursday, yesterday. It was sold in 5 minutes. We made another 6,000 liters this morning. It's sold. We're making another, I think there's 10,000 on the way there. No, it's sold. We're continuing to focus and make it every single day. So really getting your order. I've also heard a rumor that a couple of our distributors on their online ordering are accepting orders for even predated. So if you had something today that could carry you over, and you needed a case in 10 days or something, something or whatever specific date, that they're accepting orders that way. And I would encourage you to do that. This product has a 3-year shelf life. So there's that means between 2020 and 2023, it's still good in 2023.
Okay. Jimmy, we have another question here. How would this product be used? Could it be used with let's say, a hydrogen peroxide-based product like ES72?
Yeah, absolutely. We have a actually, we talked about that a little last week. Our Enviro Solutions ES72 is a hydrogen peroxide-based formula. It's diluted at 4 different dilution ratios for 4 different specific cleaning tasks. That would be one specific product I would use to pre-clean a surface in a commercial building, a school board, a hospital, a municipality, an arena, all types of facilities, production facilities, all around, where you pre-clean using that and then follow up with either ES15 or your disinfectant of choice. Our ES64 and 364, we talked about last week, has that 5-minute dwell time, effective against coronavirus, is neutral, and also has a norovirus kill claim, so an exceptional detergency.
Okay, good. And Jim, this is from Aaron. He's saying, I've been using ES72 to clean, and ES64, I would imagine he has here instead of 63, ES64 to disinfect, at the advice of my Charlotte rep. And he was asking, if he has to use, he's now using the ES364.
Okay.
And he's noticed that it's more noxious in the air. And he's asking if he needs different PPEs.
It's you went to 364. Simply, it relates with the 5-minute dwell time, which is quite honestly more realistic than 10 minutes. And what that dwell time means, Aaron, is that that disinfectant has to, at use dilution, has to sit on the surface for the specific time. So if it's 64, most traditional disinfectants are 10 minutes, which is a little unrealistic unless you really put a fair amount on, but the ES364 is 5 minutes, so it's better. I would recommend, it is a little bit more potent than 64 without question, has superior detergency and great kill claims, and the norovirus kill claim in 5 minutes. I'd suggest you revisit your SDS and look at your PPE and take that into account when you're using it. The other thing too is the temperature of water makes a difference when you're diluting or when you're using a product. The hotter the water, the more it sort of vaporizes like a tea kettle. If it's running, the vapors come up in the air. Well, the hot water in a disinfectant solution, some of that mist will come up, and if you're the least little bit sensitive in respiratories and eyes and things, it'll affect you. So try cooling the temperature of the water down a little bit there as well, and that should go a long ways to helping you.
Okay, while we're on the subject of PPEs, Greg asked another question here, Jim. What PPE would you recommend to disinfect a room where a coronavirus patient has just been present?
Well, there's deep clean protocols, and I think I'd prefer to hand that technical side over to you, Asquith, because you would probably have a better answer to explain it.
Okay, well, what I would recommend would be that you wear gloves, absolutely. You also should wear an N95 mask. At the same time, you use a very good disinfectant that's on that list that we spoke of. And that list is, the emergent viral pathogen list. So, and of course, ES15 is one of them. ES364 is another. ES364 as well. So these are things that you have to use, and you should clean first and then go back and then disinfect. Any other questions you got there, Jimmy?
Well, I've got one here. I'll just turn the tides on you here, Asquith. It's I think we've only got time for this one last question, as a matter of fact, too. But I'm located in South Florida. Which distributor will be stocking ES15 for that disinfectant?
Oh, just see a Charlotte rep. I think that's an easy question there, Jimmy. Just see a Charlotte rep, and he'll have that answer for you. Absolutely.
Yeah, terrific. And don't forget there's all modes of getting a product to you now from, there's common carrier everywhere, all of the, the carriers and freight, and we can ship things out like that. Distributors have online ordering, take advantage of that, and away we go. So I think that's all the time we have for specific questions today. Listen, this isn't the end of it here. Obviously, we'll have a much even stronger position, better position, hopefully better news this time next Friday that we can bring you up to speed. And we appreciate everything that you're doing out there, everybody's efforts to make it a cleaner, healthier space. And we'll sign off now. And any questions that come in we haven't answered here, because there's all kinds of them, we'll do our best to do it and reach out to us here. And we'd just like to say thank you for listening today. Thank you for coming on, and stay safe. Thank you.